Hello everyone, I'm Dr. Anuj, an MBBS intern at Government Medical College Nagpur. Welcome back to my channel, and in this video I'll be discussing how you should approach final year, what should be your strategies during the final year, how you should approach all the subjects that you're posted in, the clinical postings, the study wise, and most importantly how you should incorporate any subscription platform that you have taken from Marrow, DAMS, Bhatia, whatever into your study schedule so that you can complete the videos in the Q bank in time so that your internship goes well and you can prepare for PG adequately. So a little bit of intro about myself. I am Dr. Anuj Pachhel. I'm an MBBS intern, and currently my internship is just 2 months of internship is left, and I'm at GMC Nagpur. Final year I think I scored like 72-73% and I got a distinction in OBGY. I also completed the entirety of Marrow Medicine plus a lot of Q banks from the respective years. So with that intro, let's finally deep down into final year of MBBS. So what are the different subjects you have and what are the books you should be using for those subjects? That's my first chapter that I want to cover. So as you all know, you've got the 4 major subjects over here which are going to be tested upon: medicine, surgery, OBGY, pediatrics. Now along with medicine, you will also have to study psychiatry and dermatology as a part of it. With surgery, you'll have to study orthopedics and anesthesiology. Then you've got pediatrics and OBGYN. So in total, you've got roughly 9 subjects in final year, and they can be a bit hectic to study. One I missed, that was radiology. They can be a bit hectic to study, but overall this is the year where you will be incorporating all the knowledge that you've gained from the previous years. So what is medicine? Medicine is a subject which will be very similar to physiology, pharmacology. That means you will be studying it from the standpoint of the physiology, okay? Just say for example cardiovascular system. So all the medicinal part of cardiovascular system, right from MI, angina, pericarditis, cardiomyopathy, ECG changes, all of that, that's going to be core medicine, okay? Same for respiratory system, you can expect something like COPD, bronchiectasis, a pleural effusion, all of these different things. For GIT, you all know splenomegaly, liver cirrhosis, ulcerative colitis, Crohn's disease. However, there is a lot of overlap between the surgery GIT and the medicine GIT, but that is the case. In medicine, you will be studying roughly 11 or 12 units. Those can be like rheumatology, cardiology, nephrology, neurology, systemic medicine, geriatric medicine, something related to that. So those are the various units you can study in medicine. It's a very interesting subject, and I think that all of the people who are watching this video should take medicine very seriously, as it is the subject which will help you diagnose critically ill patients. It will help you see the reports of the patients in internship and make a diagnosis by yourself, and it is the subject which can be very lengthy for most people who are watching this video, because overall medicine is the most heaviest subject in all of MBBS. Even compared to surgery, I feel medicine is pretty heavy, and if you look at the video lectures, Marrow has got like 260 lectures just for medicine, so that is pretty big. So it's a very important subject and you have to pay a lot of attention for it, okay? Along with it, I told you have to study psychiatry and dermatology. Psychiatry, however, you don't have a separate book for it, but it's a subject which will be integrated in medicine. You'll definitely have a few short notes as well as few MCQs from psychiatry itself. In psychiatry, you have the topics like eating disorders, very importantly, and tested upon schizophrenia and psychosis, and the different spectrum of diseases that lie between these two ends, okay? Major depressive disorder, bipolar disorder, all of that. So that is in short what is psychiatry. Dermatology, those are the skin conditions. So right from the appendages which are involved, so skin glands, that sweat gland, oil gland, hair, those are involved. Vesicobular disorders, you might have heard of psoriasis, you might have heard of impetigo. So all of these are different disorders of the skin which you'll have to study in dermat. It's a very interesting subject, and on a day-to-day basis you will definitely a lot of patients of dermat. In your home, somebody might get a rash and you are the first person they contact. If you're sitting in an OPD, coincidentally if you come across a finding, okay, you might be able to diagnose a pretty serious condition. So for example, neurocutaneous disorders, you will see cafe au lait spots present in the body. If you see that, that can point you towards diagnosis of neurofibromatosis or tuberous sclerosis or different disorders. And from a PG standpoint, dermat is one of the most important subjects that you can encounter because it's got a lot of clinical integration in it as well. So that was the short summary of what you have to study in medicine. Definitely do not skip psychiatry and dermat thinking that medicine ka part ye nahi hai, and just focus on clinical medicine, because these two, your examiners are going to ask question on this, and overall you should know about this. So yes, dermat and psychiatry, I made this mistake, but in the last 6 months I corrected it. I focused a lot on dermat and psyche at the end, which really yielded me good marks. Alright, so that was the first subject, that is medicine. Now let's talk about surgery. So this was one of my most favorite subjects in entirety of MBBS. I also gave the surgery quiz that was held in AIIMS Nagpur. We secured a second runner-up in that position. So yes, surgery was a very very lovely subject for all of us, and the reason was our surgery unit in GMC is excellent. So they teach us a lot of different stuff. Even as final years, we are able to attend the OTs and learn a lot of things. And yes, so that's the basic reason why I really loved surgery quite a lot. So in surgery, what do you read? From a practical standpoint of view, you do read a lot about the visible things that happen. For example, tumors, the swellings, okay, the cysts, the things which you can palpate, so lumps, different places which are present, the ulcers which are present. So all of this from a clinical standpoint, but from a textbook standpoint, you read different systems. So the first is general surgery, and then we have got the specialty surgery. So in general surgery, you have got the hemodynamics, so it's shock, burns, etc. And then in that you have got suturing techniques and the practical part of surgery as well. In the systemic surgery, you actually go system wise. So for example, the most important system is GIT. So in GIT, right from esophagus all the way to the anal canal, there are so many diseases that we read in stomach, right from different types of ulcers to cancers to everything in between. Same for small and large intestine, pancreas, spleen. Okay, so basically every organ mein jitne bhi surgical problems you can imagine, you study that in surgery. That you've also got urology, you've got endocrine, you've got breast, and you've got plastic surgery as a small unit. So overall, I personally feel like if you've read surgery once, it's easier to recall than medicine, because medicine you have to remember the entire pathway. In surgery, I told you, you study 2 or 3 subjects, namely first is orthopedics. So ortho ki you have to buy a separate book, you have to study a lot in ortho, because that's like a separate paper in itself with surgery 1. You might be having it with surgery 2, the pattern might have changed, but ortho is always tested upon. In ortho, you study about the different fractures, the different inflammatory condition of the bones, the different tumors of the bone, and also about certain types of treatments for the same. So that's ortho summarized for you. It's not difficult, but you have to read it to understand it. It's not like you can kuch bhi likh ke aa jao, aisa nahi ortho. If you know it, you know it. If somebody asks you, okay, what's Dickey's tendinosynovitis, if you know it, you know it. Otherwise, you don't know it. So that's the thing with ortho. In surgery, if somebody asks you what is acute appendicitis, you can probably write something on your own, but that's not the case in ortho. So don't take ortho lightly, because one of my friends did that, and it was very very bad for her. So please make sure that you study ortho as well as with surgery. Another subject with surgery that you study is anesthesia, because they go hand in hand, right? Anesthesia hota hai, tabhi surgery hoti hai. In anesthesia, you get usually 1 or 2 questions in your university examinations, but from a clinical standpoint, anesthesia is a very 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 important subject. It's the life-saving job. The anesthesia people in the clinical settings do handle the ICUs mostly, along with the medicine people. So anesthesia is like complete. You should know at least the basics, that is different types of anesthesia: general anesthesia, spiral anesthesia, epidural anesthesia, total intravenous anesthesia, different types of blocks, for example, Bayer's block, regional block, ankle block, plexus block, ring block. So these are the various types. You will also try to, if you go to anesthesia posting in internship, you will be able to do these techniques by yourself. You do get a spinal anesthesia thing in your internship if you are doing the postings well. So that was anesthesia for you in a nutshell. And lastly, with it, you also do read a bit of radiology. However, radiology is integrated with surgery as well. And for radiology, most importantly, just read the core surgery and medicine. And with it, you will study a radiograph. So you don't have to go very detailed into radiology. From a PG point of view, radiology is the topmost branch, of course. But apart from that, also a very interesting subject, because it sort of serves as a revision for all the subjects. For example, pediatrics में भी तुमको radiographs आएंगे, medicine, surgery, OBGYN में तो ढेर सारे radiographs आएंगे. So that is the deal with the entire second subject, that was surgery. Now moving on to pediatrics. Now a very very cute subject. It's a bit shorter compared to other subjects in the final year list, and the main reason is you cover a lot of it during the postings of medicine as well as PSM, and also a little bit in your, I would say, surgery. Also you cover a little bit of pediatric surgery. So in pediatrics, you're going to be reading about the pediatric medicine. Okay, that means ki all the diseases that are happening to the child. So it can be inflammatory, infectious, traumatic. Okay, so there are different system-wise approach. So CVS may you will read about congenital heart defects and how do you treat them, how do you identify them, what are different types of murmurs. So it is basically cardiology but for children. So and for pediatric population. So that's the essence of pediatrics. But most importantly, you have to know that biochemistry and medicine and PSM. If you have done these 3 well, most of your pediatrics is covered. Only the core pediatrics, let's say like 50% of pediatrics is left. for a UG standpoint. For a PG standpoint, is completely different. You have to remember that in pediatrics, all the 3 subjects that I just talked about should be done along with it, and this will serve as a very good nidus for vertical integration of different subjects. Next, last subject is Obs and Gynae. It's a very lengthy subject if you do read it for PG, but for your UG examinations, you are good with sticking to just 1 or 2 books or even notes for that matter. Mostly in Obs and Gynae postings, you're going to be finding obstetrics cases much more than gynecology cases. Let me tell you what's the difference. Obstetrics is when you deal with the pregnancy and the postpartum, and gynecology is you deal with anything relating to women but in a non-pregnant state. So that is gynecology. So in the obstetrics, you're going to be studying everything from first, second, third trimester to labor to postpartum complications like PPH, etc. And in gynecology, you'll be studying like fibroid, carcinoma, cervix, carcinoma, uterus, and ovary, and amenorrhea, hypermenorrhea, hypomenorrhea. All of these things are in gynecology. So I think that was sort of the summary of the entire subject. Now let's quickly talk about what are the books that you should be using for each of these. So let's talk about medicine first. There are 2-3 options. I'm going to be telling you my preference, and you can go with it, you can not go with it, it's all up to you. So I read Archit Bulur sir's book for medicine, and I think it's wonderful, it's splendid. Other options for you are, you can go with Davidson or you can go with Harrison if you're going to get a lot of time, but it's not a compulsion to read Harrison at all. Actually, it's a book for PGs. Most importantly, you should know that at least from any book you should have done medicine, because no matter whose videos you watch, I've personally watched all of Rakesh sir's video, but I feel like the knowledge which I got from books was equally important in strengthening my subject as I got from the videos. So always remember, textbooks are your go-to, videos are okay, but textbooks are your main source. For psychiatry and dermat, these are integrated into the medicine itself. So in Archit Bulur sir's book, you'll find psychiatry and dermat as a section. So after the clinical medicine has ended, you will find psych and dermat. So एक book में ही तुम्हारे 3 subjects cover हो रहे, which is fantastic. Next, for surgery, let's go. The book which I would recommend all of you guys to be using is Bailey and Love, but most of the people find it a bit difficult to read. It's not a compulsion. Again, I said the best book is the one which you can read, retain and assimilate, and also regurgitate the information when needed. So if you find that this thing, Bailey and Love, is not for you, then there is no pressure and okay, you have to read it. The other book which you can read is SRB. So SRB sir hai, and he has written an amazing book. So that is one thing. Another one is Manipal. So these are the various books for surgery, the theory books. Okay, I have personally read SRB. I loved it very much. And for ortho, Maheshwari karke ek book aati hai. That's great. For anesthesia and for radiology, no extra book is needed. In SRB, it is given as an integrated section, just like psych and dermat. Next subject is pediatrics. The book I would be recommending is Ghai. So OP Ghai is amazing. A lot of the people use it as a standard textbook for pediatrics. The top book is of course Nelson, but that is only reserved for the pediatric residents and the PGs. So that's a different book in itself. Lastly, OBGY. Shaw is the book for gynecology, which you can use, but I would say that personally I still have not been able to find a good book for OBGY. So I used a Marrow lectures ke notes. I had edition 5 notes, so I used that personally for preparing for OBGY. But I would still recommend कि DC Datta's book is okay. It's okay. It's not good. I would say it's okay. ठीक है यार, मतलब पढ़ने में उतना मज़ा नहीं आता, बट ठीक है, वो कुछ और ऑप्शन नहीं है तो पढ़ना पड़ेगा. इट्स लाइक खुराना इन ऑफ्थैल्म, कुछ ऑप्शन नहीं है तो पढ़ना ही पड़ेगा वो. So that's the thing, you can use Datta, but I would say Marrow notes are more than enough for OBGY. But just for the sake of including a textbook, I had read the DC Datta's textbooks. I tried Shaw. My friend also tried Shaw. She liked it. I did not like it that much. So that's the deal. So those were all the books. Those were all the books for theory. So let's talk about practicals. So practicals में होता क्या है? You have got to attend clinics. You have to learn how to take cases. You have got to learn how to take history, and how to present the case is very, very important. So you have to actually summarize the symptoms and the examination points, and then come to a diagnosis. So that's your case, and you don't have to include any investigations in it. For every subject, this is the same. Is going to be the same. I've already got a masterclass on history taking and clinical examination. I've got the link in the description as well as this card over here, so you can click and check it out by yourself. After this video is done, that video is unlisted, so you'll be only finding it through links. So you can save that link, share it in the group or whatever. So let's talk about practical books. So for medicine, I use Kundu sir's book. So I actually was a co-speaker with Kundu sir at CNMC back in September of 2023. So that was a very big deal for me because I read his books and he was a speaker with me in the same event. So which felt really amazing, to be very honest. So Kundu sir's book I really loved it. So you can try Kundu sir's book for clinical medicine. Second book I would recommend all of you guys is Archit Bulur sir's book for clinical medicine. It's amazing. It's really great. So these two books should be enough for you to do your final year medicine ka very well. The book that I absolutely loved is S. Das, but along with S. Das, you can also use Makhan Lal Shah. Amazing book. Both of these books in combination you can use, or you can use individually. Makhan Lal Shah is a more complete book, so I personally loved Makhan Lal Shah more than S. Das, but I did not have that. My friend had that, so he read Makhan Lal Shah, I read SRB. Then in the end, I also read Makhan Lal Shah. So मैंने दो तीन books पढ़ लिए. And just 2-3 months ago, I also took a complete workshop for clinical surgery, and for that I used Makhan Lal Shah as the reference book. A lot of students attended it. They got a lot of benefit from it as well. So I would say either of the book works absolutely fine. Next is pediatrics. The book which I used for pediatrics was called as Chheda. So Chheda is one book. And that was pretty good. But other book which I absolutely recommend all of you guys is Lakshman Swamy. So Lakshman Swamy is a gold mine. So you can read that, and it will also help you with clinical pediatrics. It will also help you in OPD. So you can just use Lakshman Swamy for your pediatrics. Lastly, OBGYN for practicals. I do not remember which book I used. So I'm just not gonna say it because मुझे याद नहीं यार, to be honest. मैं बहुत देर से सोच रहा हूँ OBGYN के लिए कौन सी यूज़ की थी, but I don't remember. If I do, I'll just put it in the description so you can check it out later. So those are all the books that you have to read in final year of MBBS. It could be a lot, I know, but it is what it is. तुम final year में हो, तुमको डॉक्टर बनना है, तो थोड़ी मेहनत तो करनी पड़ेगी. ऐसे फ्री में नहीं बनने वाले तुम लोग. So with that, I guess let's move on to the next part of the video. That is, how do you actually attend clinical postings? How do you make the most of it? So there are 3 steps in attending your clinical posting and making the most out of it. The first step, of course, is to go to the clinical posting, because most of the people don't. Okay, and in final year, this is the last chance for you to capitalize on your own personal college or hospital. क्योंकि तुमने नीट यूजी में जितनी मेहनत करके एक हॉस्पिटल लिया है, the main reason you took it is because of the various amount of clinical cases you're going to be seeing. So in final year, that is a golden opportunity. Definitely utilize that and go to the clinical posting. Second, whoever is the resident over there, 1, 2, 3, जो भी तुम्हें मिले, just ask them what are the main clinical cases that we have to study, and they'll give you a list of 10-15 cases which are most important they see on a day-to-day basis. Go home and read at least 5 or 6 of them. Next day, go to the ward and take the case. At 8 a.m. you should be in the ward. At 8 a.m. you should be bedside to the patient, and you should be starting to take the history, because the rounds, they start at 10, and once the rounds have started, nobody is going to give a shit about you. So make sure that your history taking examination is completed before 10. So that's usually the norm here in GMC Nagpur. At usually 9:30 or the 10, all the seniors, that is the lecturers and APs, all of them come and the round starts. So at 8 a.m, bedside to the patient, start taking the case. It will take you at least 1 hour initially, but as you get better at it, you can do it in under 10-15 minutes. And that's actually what I taught in my mastering history taking class, as well as in my workshops which I conduct at my home. You can be asked to present a case, and if nobody is asking you, go to the resident or go to the senior resident. And even if you can go to the lecturer, go and just ask them, sir or ma'am, please, I've just taken the case, let me present it. Tell me what are the mistakes I've made, and you can also teach me something along the way. They'll be very happy, they'll be super enthusiastic to see that you have done that, and they'll be definitely teaching you more because they see that this person is actually interested. For most of the colleges, guys, like except for 2-3 colleges, अगर तुम छोड़ दो, most colleges में clinical postings में nobody gives a shit about you. They are busy in their own work, and as an intern, I know that there is so much work in the ward that JR 1, 2, 3, all of them are busy. Okay, so you have to show interest from your own side in order to get noticed, to be taught well. If you're in a private college, the scenario is completely different, but for most government medical colleges, this is the case, that you have to go from your own side, ask them to teach, and only then they will teach. Only few excellent colleges in the country, for example AIMS maybe, or maybe KEM, they teach it. But I have even heard from those people that are in this colleges कि ऐसा नहीं होता है, कभी-कभी हमको भगा देते हैं ward से. So I hope that this makes you understand the importance कि you have to be there early, take the case, present it, and learn from it. The more number of cases that you're going to be taking, it's going to get better and better. Your skills are going to be improving definitely, and within just few seconds or few minutes, you'll be able to complete your entire clinical examination, and that too with efficiency. So yes, that is the thing. Of course, the more variety of cases that you see, it's all good, but now you have to mostly focus on learning the basics. Okay, that means the basics of examination, the basics of history taking, how to present a case. थोड़े specific case to case variations होंगे, वो तुमको समझ जाएंगे. Alright. A lot of the people also prefer to go in the evening. So after I used to do that, my friends used to do that. So we had a group of 10-12 people, and we all used to go in the evening routes as well. तो तुम चले जाओ around 5:30-6 बजे के करीब. Everybody has left. Okay, evening round होने को time है. And from 6, the resident or whoever is present in the ward, they can teach you till the round ends. So that is the thing कि you have to be there early, and they will teach you. So in the evening also we used to attend rounds and it actually really paid off because हमारा कोविड के कारण काफ़ी सारा posting miss हो गया था in second year and third year. So we had to make up for that using double postings. So morning evening दोनों समय जाते थे. In internship that's actually what we do. Morning evening दोनों समय जाना होता है. Right, the next part of this video is how should you actually focus on your PG preparation while you are in final year. So let me make this very very clear कि if you prepare well during your final year, your internship years are going to be easy. So whatever first year, second year, third year ka information gap that you've got left in your life, in final year you have to cover all of that, because in internship it's extremely difficult to focus on your PG prep while managing duties and the toxicity of the seniors and everything. It becomes difficult. So in final year, try to fill your lacunae, try to manage your time with clinical postings and studying to also fill the backwards gap. So anatomy, physiology अगर तुम्हारा खराब होगा, निकालो टाइम में से टाइम और थोड़ा बहुत उसे पढ़ लो, ठीक है. If you can't watch the main videos, go with the revision videos. They are short, they are sweet, and you will be able to revise a lot of subjects quicker and quicker. With respect to the main final year ka syllabus, if you can finish all the videos in like 6-7 months, which is perfectly doable if you do like 5 videos a day. 2x पे देख रहे हो, 3 hours, maybe 3.5 hours में you'll be able to finish 5 videos every day. And with that 5 videos वाला pace, in 6 months you can cover the entirety of final year from Marrow. I use Marrow, इसलिए मैं Marrow बोल रहा हूँ, कोई paid promotion नहीं है, कुछ नहीं है, ठीक है. So I used Marrow, therefore I'm saying कि you can use it as well. Most importantly I would say कि consistency is key. So if you find yourself falling off continuously, ऐसा कुछ नहीं है, just find an accountability buddy. एक किसी दोस्त को पकड़ लो and just tell them कि okay, just keep me in check, ask me every day if I'm doing well, ask me if I'm watching the videos, etc. So that is the thing कि try to finish all the videos since you are going to be watching this video in the starting part itself. 6 months में videos finish कर लो, then simultaneously you can move on with the books. And once you have done the videos, your books will be so easy, तुमको बहुत easy लगेगा. And don't ever forget that the notes which you are making for your from your videos are, don't ever forget that the notes you are making are for your internship. Okay, so थोड़ा ऐसे बनाओ कि वहाँ पे तुम points add कर सको, थोड़े sticky notes add कर सको, and make yourself easier in internship. And don't make the notes too bulky, because in internship it's difficult to study the bulky notes. Short and sweet रखो so that in internship you do well. Anyways, in final year, except for OBGY, all the other subjects तुमको textbook से ही marks मिलेगी. अगर तुमने सिर्फ videos करके गए, it's very difficult for you to even pass. I'm just gonna say it very nicely कि सिर्फ अगर तुम वीडियोस करके जा रहे हो, पासिंग भी डिफिकल्ट हो जाएगा. टेक्स्ट बुक्स आर मस्ट इन फाइनल ईयर, सो जस्ट रीड द टेक्स्ट बुक्स एज मच एज पॉसिबल. there's this one person, सोशल मीडिया इन्फ्लुएंसर है, दे मैसेज्ड मी एंड आस्क्ड मी कि सर क्या करो, मेरा एग्जाम है. आई आस्क्ड हाउ मेनी बुक्स हैव यू रेड, तो दे आर लाइक मैंने बुक्स खरीदी नहीं, मैंने तो बस मैरो के वीडियोस देखा. मैं बोला हो गया भाई तेरा. So that's the thing कि you don't have to just think कि मैरो कर लेंगे तो हो जाएगा. There is no replacement to textbooks and going to watch how many times should I say this in this one video. Okay, next let's talk about the question bank. So question bank on your own pace you can do. There is no compulsion कि you have to complete the question bank etc, because that is what you're going to be doing in the internship. So don't worry about it too much कि question bank पूरा complete करना है. If you can do it, well and good. If you can't, don't take it as a bit of a serious. Another thing, start giving grant tests in the mid of the final year. Don't ever think before giving a grant test, okay, when I have not really studied anything, I'm going to get bad marks or good marks or whatever, bad percentile. Don't think that. Just sit down and give it, because initially तुम्हारे marks खराब आएंगे. You will score like 70, 60, whatever, and it's going to be bad. Okay, so you don't give it for the score, you give it for the feeling. Okay, जैसे तुम्हारे if you are familiar with the NEET UG exam, you had the exam after the 12th, but you were giving grant test since the 11th standard. Okay, you are giving the 3-hour wali test since 11th standard. So that's what you have to apply over here. कि final year is your 11th and 12th wala is your internship. So start giving grant tests without preparation. Also, I did that. It paid me a lot, because the reason is I was able to excel at time management. I used to understand that in final year, if you give like 5 to 6 GTs in final year, you're at a very good place to start an internship. You already know your progress. You've already got the list of your good subjects, your weak subjects, your intermediate subjects. So in internship, you can directly dive down into the weak subjects and increase your marks dramatically. So that's the goal for your final year. I think that I've covered all of the topics. Okay, one more thing I really want to speak. It's with respect to breakups and emotional function during final year. So you'll find that you'll lose a lot of friendships during final year, mostly because you'll just face it and you'll just know it कि ऐसा हो सकता है. I lost a lot of friends, I lost a lot of good ones as well in final year, and don't ever let that thing stop you. Okay, just focus on your studies, focus on good things, and if you are in a relationship, if you do have a breakup, don't let it destroy your final year. Okay, final year is much more important than a random stupid breakup you had in your college life, which is insignificant to you in your life. उस समय बहुत significant लगेगा. बट ओवरऑल उतना सिग्निफिकेंट नहीं है. सो एनीवेज ये सब चीज़ें होते रहेगी लाइफ में, बट उसके कारण अपना साल बर्बाद नहीं करना है. आई हर्ड अ लॉट ऑफ स्टोरीज की माई फ्रेंड्स आर ट्रीटिंग मी डिफरेंटली एंड आई कैन नॉट रियली स्टे विथ माई ग्रुप. देर इज सो मच कॉम्प्लिकेशंस इन माई ग्रुप. पीपल आर डेटिंग ईच अदर. नाउ दे आर हैविंग ब्रेकअप्स and now I cannot fit with them because I have to talk with one person. I cannot talk. Blah. So stop it. Okay, don't. If you are part of that group, get out of that group. Okay, find your new group. अगर अकेले रहना तो अकेले रहो. So friends are gonna leave and people are gonna get toxic. And finally, if you do end up having a breakup or having a group breakup or having a friendship breakup, don't let it affect you mentally because this is a very very important year. Your internship directly depends on how good you did your final year. If you did your final year well, तुमको clinical subjects easy जाएंगे जो कि major subjects होते हैं नीट पीजी में पूछने वाले. And if those are well, then you don't have to worry about your PG preparation that much. So I guess I have summarized everything. And if you did enjoy this video, please make sure to hit the thumbs up button and also subscribe the channel. And do share this video with your friends if you relate to the last point especially. Really यार सही में do subscribe. A lot of people watch but they don't click the subscribe button. तो कर लो, support हो जाता है. Anyways, thank you so much for watching. Again, it's your boy Anuj. I'll catch you in the next one. Goodbye.